I'm Megan Szymanski, and I'm a nurse practitioner at Female Pelvic Medicine and Reconstructive Surgery at Prisma Health. This video was made for patients who wear pessaries and desire to manage their pessaries at home. In this video, I'm just going to talk about how to manage your pessary at home. So I'll go over removals, basic care and cleaning, insertions, and I'll also answer some frequently asked questions. There will also be demonstration videos on how to insert and remove specific types of pessaries. A pessary is a silicone device inserted into the vagina. They are great non-surgical options for treating vaginal prolapse and/or urine leakage. They allow you to be comfortable and active, avoiding surgery, but they do require ongoing care to avoid problems like discharge, odor, or ulcerations. Often you're able to manage your own pessary after receiving teaching from your provider. You may prefer to remove and wash the pessary yourself, and actually we encourage you to do so if you're physically able and willing. There's lots of benefits to managing your own pessary. It not only cuts down on vaginal discharge, but it can decrease the risk of vaginal irritation from the device itself. We don't need to see you as often for your pessary checks and exams, and so it does cut down on office visits and therefore healthcare costs. You also have the ability to wear the pessary as much or as little as you want when you manage it at home. We do recommend removing the pessary 1 to 2 times a week, leaving it out overnight, and replacing it in the morning. With practice, you'll discover which position works best for you for pessary removals. Some women prefer lying down, squatting, or standing with one leg up on a chair. Sometimes if you bear down slightly, it helps bring the pessary closer to the vaginal opening, and then it's easier for you to reach. If you're having difficulty with removals, let your provider know, and we may have a solution for that. There will be demonstration videos later that will discuss techniques for specific pessaries. Cleaning the pessary. After removal, you want to wash it with warm water and soap. If leaving it out overnight, you can let it air dry, or you can dry it with paper towels. Do not microwave, boil, or use any harsh chemicals or detergents when cleaning the pessary. Inserting the pessary. Wash your hands. Just like pessary removal, you'll find which position works best for you. We recommend applying lubrication to the leading edge of the pessary, as this helps it slide in easier. Common lubricants are KY jelly, coconut oil, or water. Here are some different types of pessaries that we use in our office. We have the ring with support, ring without support, ring with support and knob, an oval, incontinence dish, Schatzed. This is the donut, a cube, and the Gellhorn. Here are some videos about how to insert and remove the ring pessary, and then the ring with support and incontinence knob pessary. So in this video, I'm going to demonstrate how to insert and remove the ring with support pessary. And if you play around with this, it's nice and flexible. It has 4 holes. It tends to fold better along the larger holes. So we say fold it like a taco with the curved edges facing up towards the ceiling. And then we want to put some lubricant on the leading edge, and all the while we're keeping it nice and folded. So you want to gently insert it into your vagina. And once it's in there, it'll open up, and then you just want to push it back as far as it'll go and up, and it'll go into place. And then in terms of removal, you just want to reach your finger in your vagina and locate the rim and pull it out with your finger. Here is the ring with support and incontinence knob, and again, this one has the knob, and we want this knob to be facing out towards the opening of the vagina. That's how it will give your urethra extra support and help with your leakage of urine. So with a smaller device, I actually don't recommend folding it. You might be able to just glide it in at an angle. If you do have a larger device, you may need to fold it in half, again, along those bigger circles, like a taco with the curved side up. So just since this is a smaller mannequin in a smaller device, I'm going to show you how to insert it at an angle. So we have lube on the leading edge, and we just want to kind of guide it in at an angle. You can see that I'm not going in like this. I'm kind of going in at an angle. And then we want to push the device back as far as it'll go. And we want that knob facing the center, facing outwards of the vagina. And then in terms of remove, you just want to reach your finger up there, grab a hold of the rim or the knob, and just pull out. So in this video, I only included demonstration of the most commonly used pessaries in our office. However, if you have one of the pessaries listed on this page and need further guidance or just want to watch the video, I provided you with the link above for demonstration for each of the pessaries not included. So now I will answer some frequently asked questions about pessaries. Can I have intercourse with the pessary in place? You can if you have one of the following types: ring with support, ring without support, ring with support and incontinence knob, incontinence dish, or shats. If you have a different pessary that's not listed on this page, then the pessary would need to come out before sexual intercourse. What happens if I start to get discharge and/or an odor? Well, discharge is common when wearing a pessary, and this is your body's way of reacting to a foreign body being placed in the vagina. The discharge is typically clear, white, or off-white in color. Talk to your provider if this becomes a bothersome issue for you. There are creams and gels that can be prescribed to help with the vaginal discharge and odor, but if you notice bright red discharge or a foul-smelling discharge, please contact our office. If you are bleeding with the pessary in, you should call our office and make an appointment to get checked out. Patients wonder if we still need to see them if they manage their own pessary at home. The answer is yes. If you don't have a gynecologist, we still need to check you routinely while you wear the pessary. Instead of every 3 months, we may only see you every 6 to 12 months instead. Is there any special cleaning required while wearing a pessary? No, you can wash as you normally would in the shower or bath. Douching and feminine washes are not recommended. If the pessary falls out or if it falls out into the toilet, you want to clean it with soap and water and reinsert it. If anything changes and you are no longer able to remove and reinsert the pessary on your own, we will want to see you in the office for an exam and cleaning about every 3 to 6 months. The pessary cannot get lost. The vagina is a closed tube, and the pessary cannot go anywhere else inside the vagina. Depending on your prolapse, you may still feel a bulge at the opening of your vagina, but it should be much better with the pessary in. If you do not have any discomfort from the bulge, it is okay. A pessary needs to be replaced if it has a tear, rip, or rough edges. You can request a new pessary at any time with the understanding that your insurance will be billed for the new device. It is possible for the pessary to change positions or slip out of place or come down, especially if you strain with bowel movements or lifting. It's okay to push it back up inside. Please call our office if you are uncomfortable or have pain, if you have difficulty urinating or with bowel movements, you have any vaginal bleeding, the pessary keeps falling out, or if you have any questions. Thank you for your time in watching this video. I hope it was beneficial. If you have any further questions, please contact your provider.